Welcome back. And it's exciting now to have an opportunity to spend some time talking about breast cancer. And this is an important part of what we have here at UC Irvine Athletics and a relationship with UCI Health. So it's fun to bring on some of the very best in the industry, and we have them here at UCI Health. I want to welcome Freddie Combs, Dr. Combs, Director of Imaging at UCI Health Pacific Breast Center, and also Dr. Karen Lane, UCI Health surgical oncologist. It's great to have them here. I want to start with you first, Dr. Combs. With breast cancer screening guidelines really shifting in recent years, can you maybe help us understand a little bit about how often and maybe at what age women should start seeking treatment?
Sure. Thanks for having me. Breast imaging guidelines are kind of a work in progress. They're constantly evolving and improving as we learn more through research. There are several governing bodies that have developed guidelines for breast cancer screening, primarily the American College of Radiology. They have a comprehensive set of guidelines for screening that most breast centers in the U.S. use. We follow these here at Pacific Breast Care Center. The reason why is statistically, it seems those guidelines find the most cancer. And in general, women should start screening at age 40 and be screened yearly, although there are certain circumstances in higher risk women where we might start before that, but that's pretty much the standard.
As we talk about some of those screening tests, first, what kind of tests are available? Kind of maybe a little bit into the why there's so many different approaches, and where do you find the most accuracy?
Yeah, sure. So mammography is the gold standard, and that's our primary screening modality. MRI and ultrasound can also be used as supplementary tests, but in general, the one screening tool is mammography. As we learn more, MRI is starting to gain some popularity, but basically research has shown that mammography performs the best. So we sometimes will add MRI or ultrasound to a mammogram to improve our accuracy, and we usually utilize that for higher risk women or women with dense breast tissue.
And when we're talking about what's being done at UC Irvine Health, what are some of those things that are maybe most important when you're trying to select a center that's going to specialize in breast screening? What are maybe some of the other quality measures that take place at a place like UCI Health?
Yeah, sure, and that is really important. Breast cancer screening is no longer a one-size-fits-all program. It's something that we are starting to individualize it towards women's level of risk and based on their family history, their breast density, et cetera. So choosing a center that has specialists that specialize in both performing and reading mammograms, MRIs, and ultrasounds, I think that's really the key. The American College of Radiology has quality measures that ensures that these centers are certified. And so as a patient, if you're looking for a breast center to go to, you should look for one that's American College of Radiology or ACR certified. And they give different levels of designation. So the highest level that you can achieve is a breast center of excellence. So my advice to the consumer is look for an ACR certified breast center that's designated as a breast center of excellence.
Thank you so much, Dr. Combs. I want to ask this to Dr. Lane. Look, when a woman is diagnosed with breast cancer, trying to figure out, okay, what are my options? What do we do now? What kind of treatment or maybe combination of treatment options should be considered when you get that information?
Yeah, sure. So breast cancer treatment is needs a multidisciplinary approach. So when you get diagnosed with breast cancer, you very well are going to need surgery. You may need chemotherapy or radiation. You also might take some medicine called hormone blocker pills to reduce the chance of the breast cancer coming back. So it's really important at UCI Health, we give the patients a personalized care plan. They have access to all of our specialists, and so we're able to walk them through all these decisions and help them make the best plan for themselves. So when a woman gets a diagnosis of breast cancer, it's usually after Dr. Combs has done a biopsy and given the patient that diagnosis. And then the patient is referred to a breast surgeon like me as kind of the captain of the ship to help them make these decisions and send them to other specialists as well.
When you talk about some of those surgical options, what are some of those maybe the latest surgical techniques that are being done and the other approach to what UCI Health breast surgeons are able to offer?
Yeah, we are very fortunate here at UCI Health. We have excellent plastic surgeons. So we are able to send the patients to discuss reconstructive options. So in some cases, a woman has to have her whole breast removed to treat the breast cancer. And now we have lots of reconstructive options, in fact, that can often use the patient's own breast or abdominal tissue or back tissue to really reconstruct them a very natural looking breast. So I think that is something very important when a woman is deciding where to get her surgical care, that she understand that there are a lot of really excellent options for reconstruction that can really make the breast look very natural.
I think when anybody has an opportunity to need medical care, everybody wants the absolute best of the best. So when it comes to UCI Health, what sets the comprehensive breast center program at UCI Health, what sets that apart maybe from others you might see and makes what you guys do at UCI just so important?
Yeah, so we have a very collaborative group here. And I think that is really, really critical. So if a patient is getting an MRI or an ultrasound or a mammogram, I'm able to look at those films with Dr. Combs in real time and discuss that together with the patient, what those findings are. Similarly, I see patients in the same clinic space as the medical oncologist. So we can go in and talk to the patient together, explain the options, see what the patient's thoughts are on the treatment. We also meet weekly and actually discuss all the new cancer cases. And that's the whole group: radiation doctors, pathologists, plastic surgeons, medical oncologists, other surgeons. So everyone has the opportunity to weigh in and really develop the best care plan for the patient. We also have social workers that can help the patient through some of the psychological aspects of a diagnosis of cancer and really provide them with resources during their treatment. And we also actually have a huge integrative medicine program at UCI Health. So for things like symptoms from the chemotherapy medication or postoperative symptoms, they can receive things like acupuncture or other holistic therapies that can be very, very helpful for the patient's overall quality of life.
Dr. Lane, Dr. Combs, thank you both so much for what you guys have been doing and also for the information today. I think this is really important for folks to just learn about what's going on at UCI Health, especially when it comes to breast cancer awareness. Thank you both.
That's great. Thanks for having us. Go Eaters.